anyone in here ever gone to the doctor when they were feeling good? There have been times in the past when I've used my body like a credit card, accumulating bad debt and not noticing until debt collectors were calling me, or I have so-called symptoms of an unhealthy lifestyle. Hippocrates is famous for saying, "Food is medicine and medicine is food." Since the age of 21, I struggled with maintaining a healthy lifestyle. I drank way too much, I smoked way too much, and sometimes I didn't even eat. I never realized enough was enough until I was on several prescription medications, obese, needed 9 hours of sleep just to function, and suffered from depression and anxiety. Many of us are unaware of what's going on inside of our body until we notice symptoms that are atypical from how we usually feel. Most medical facilities in this country exist to treat symptoms of full-blown disease, but there is a rise in clinics that promote preventative health care, like the one that I currently work for, Pamisage Health. Today I'm going to talk to you about the pressing need for preventative health care awareness and why you need to act immediately. Hopefully by the end of my discussion, you will be ready to build positive credit in your body and not prepare it for bankruptcy. So let's go ahead and get started. So the problem is, our country practices disease care and not health care. People are no longer dying from acute illnesses. We have vaccines in place for that. People are dying from chronic illnesses, which are preventable. With chronic illness, people can live for decades with a miserable quality of life. I will give some examples of chronic illnesses here in a bit. Simply put, there's just not enough preventative health care being practiced. This has to change. According to the Center for Disease Control, or the CDC, 7 out of 10 U.S. deaths are caused by chronic illnesses, which roughly half the country's population has been diagnosed with a chronic illness, including heart disease, cancer, diabetes, AIDS, and other conditions classified by the medical community as preventable. This issue affects not only everyone in here today, but everybody in our country. Insurance prices are at an all-time high because for the first time in history, our average life expectancy is declining instead of growing. Like I stated, this creates a specific need for emphasis on preventative health care. We should be preventing disease, not just treating symptoms. According to the Centers for Disease Control and Prevention, nationally, Americans use preventative services at about half of the recommended rate. Cost sharing, such as deductibles, co-pays, and co-insurance also reduce the likelihood that somebody's actually going to use a preventative service. One study found that a rate of women getting a mammogram went up as much as 9% when cost sharing was removed. So if they didn't have to pay a deductible, then they went, basically. The CDC also states that chronic diseases among Americans each year account for 75% of the nation's health spending. These chronic diseases can be largely preventable through close partnership with your healthcare team, or can be detected through appropriate screenings when treatment works best. So luckily there is a solution for this problem. The solution is prevention. Prevention teams should go into place. These teams help people to monitor their health regularly and keep them engaged in an integrative approach to optimal health. People should have cancer screenings and diabetic testing done. Regular exercise and a healthy diet paired with behavioral health services is essential in maintaining longevity. So I have a visual aid here that is the benefits of our children of optimal nutrition. So by optimal nutrition, we're defining what's in the good range. You know, their body fat percentage is within normal, their basal metabolic rate is at a healthy range, their body mass is good. So type 2 diabetes is a 90% decrease in this population. Heart disease and stroke, 80% decrease. And then diet-sensitive cancers, 60% decrease. We're talking about our children here. I don't know about you guys, but I have a 3-year-old daughter at home, so it means a lot to me. So sorry. Like I stated, this creates a specific need for preventative health care. Oops. Sorry. Got off track there. According to an article by The Balance, the goal of preventative care is to help people stay healthy. The idea is to nip diseases in the bud before they become catastrophic. That keeps healthcare costs low. It also keeps people productive, enabling them to keep working well into their senior years, which also affects the economy. It's a good thing. Most people don't realize that healthcare costs are the #1 cause of bankruptcy. They also don't know that 46% of retired people were forced into retirement because of healthcare problems, which are all considered preventative. I want you, as my audience, to live a long and healthy life. One thing you can do is go to the healthcare.gov website. They've got a great tool on for your age range, what screenings you should be doing, how often. If our nation's healthcare continues to plummet, not only do we lose out on quality of life, we lose lives, and this applies to you and your loved ones. This is worth the price of commitment because it's our health. Most health insurance plans actually cover preventative health care, which a lot of people don't know. The biggest investment you must make initially is time and to stay dedicated to your health. My next visual aid, to me it's a simple visual aid, but it's kind of like, what do we want to be? Are we putting band-aids or trying to find the cure, which is prevention in this light is prevention. So many people say if integrative teams of medical professionals are implemented for Americans, it's going to cost more upfront for health insurance companies, in turn causing the health insurance companies to raise group rates. This is a very popular argument amongst the medical community. For example, if a benefits coordinator at Ferguson Enterprises wants to initiate a wellness plan and they use Anthem Blue Cross Blue Shield for their employees all start going to the screenings, getting preventative health care. Obviously for that year, the group cost is going to look like it's higher. So in turn, they could turn around to the benefits coordinator and say, okay, open enrollment's coming up. Now we're not going to give you as good of a deal. That's an argument, but there's a counter argument on that, in that it does cost them money. But I want to emphasize that in the long term, it actually ultimately costs them less, because we all know how much disease costs. So you may be saying at this point, what's in it for me? Well, I wanted to use a real life example. So let's talk about the average American Bob, and this is somebody I know, but I'm using a different name. So for example, Bob decides to have a routine checkup and the doctor tests him for diabetes. Much to his surprise, he comes to find out that his blood sugar levels are pre-diabetic, and his doctor tells him he's at 67 pounds overweight. Bob's physician recommends prescription medication to stabilize the diabetes and refers Bob to a dietitian to help him improve his dietary intake, and a health psychologist to determine why Bob is waking up at 2 o'clock in the morning and craving peanut butter and jelly sandwiches. After 6 months, Bob has become more enlightened, more self-aware. He has an exercise plan, he knows his total energy expenditure for the day, basal metabolic rate, feels better, and he's lost 47 pounds. He returns to the same physician to find that not only is he not pre-diabetic, but his health is actually on the rise. Bob has never felt so great. Bob was so used to living with a chronic poor quality of life that he had no idea how bad his health even was. So Bob went to a clinic like the one I work for that offers integrative wellness services, health psychologist, dietitian, yoga instructor, group therapy, and the clinic. Obviously our clinic bills insurance, which will show up. However, now 6 months later, Bob goes to the gym 3 times a week, which our clinic also covers. He's covered group therapy, and he's actually not taking his 2 prescription medications that he was taking anymore. So now the company is saving money on that too. This ultimately has improved his longevity and added years onto his life. In the long term, he's less susceptible to depression and anxiety because he's more self-aware. So now here's another real life example, Tina, a middle-aged single mom who works full-time and a part-time job to make ends meet. Tina suffers from exhaustion, depression, and anxiety. Like most Americans, Tina's quality of life has been low for so long that she's kind of used to it. It's her norm. Although she feeds her children healthy meals and takes care of them, she doesn't take care of herself. She doesn't eat regularly, she smokes, and she drinks above the average amount. So she obviously doesn't engage in preventative health care at all. Recommended for women her age, which happens to be for this year a mammogram. She's too busy, doesn't feel any symptoms. So after several months go by, Tina notices that she feels more tired than usual, is getting tenderness in her breast, and feels nauseous. Now she decides to go to the doctor, like most people, because she's feeling symptoms and she's concerned. Tina's top priority is getting this fixed. So she schedules the mammogram. When the results come in, there's a benign tumor in her breast, but she still has to have surgery for it. She has to have invasive surgery for it, but also goes into rehabilitation appointments for 2 weeks to follow her progress, monitoring her recovery. She misses work, she has childcare issues, all that. So her insurance is billed, let's say $1,500 for the initial mammogram, $47,000 for the removal of the tumor, hospital stay, anesthesiologist, medications, all of that. Tina's insurance is billed daily for therapeutic intensive rehabilitation for 2 weeks at a total of $17,000. Tina needs more radiology to ensure that the entire mass is gone in the following months, coming in at a total of $70,000, right under $70,000, which is actually a modest estimation. It's more than that in some cases. So if she would have just gone and gotten her routine mammogram, maybe they would have caught it earlier, maybe they wouldn't have, but hey, that's the thought. So according to studies from the Fred Hutchinson Cancer Center in Seattle, not only are cancer patients two and a half times as likely to declare bankruptcy as healthy people, but those patients who go bankrupt are 80% more likely to die from the disease than other cancer patients, which means the symptoms of bankruptcy and the anxiety of bankruptcy is just as harmful to your body as the symptoms of cancer treatment. So, in conclusion, you can start by having routine wellness examinations done. Clinics like PAMSH Health provide an integrative approach. We talked about that, going to the healthcare.gov website. I'm a assistant psychologist and a health coach, so you can see me after class. I've actually brought some cards with me. Become engaged in your own health. Educate yourself. So today I've talked to you about the importance of preventative health care in our country and the importance of getting routine checkups, actively engaging wellness programs specifically designed for you. So some people think the whole plant-based or whole foods diet is extreme. According to Dr. Kakalis, health psychologist, over 500,000 people this year alone will have their chest cut wide open and their leg open to take a vein that will be sewn into their coronary artery. Some people would call that extreme. So I'm gonna go ahead and light this candle to symbolize all that we've lost to disease, those that are suffering with each breath they take. Because this is my passion. Let this light illuminate the way for those to see that preventative health care is the future of not only the medical industry, but of your own tomorrow.